Welcome to today's webinar titled Preventing Skin Cancer, What Strategies Are Right for You? I'm Krista Rubin, your host. I'm a nurse practitioner at Mass General Hospital in Boston, Mass, and I specialize in caring for patients with skin cancer. And joining me today is Dr. Sue Park. Dr. Park is an assistant professor in the Division of Hematology Oncology at the University of California, San Diego, Moores Cancer Center. Dr. Park also specializes in caring for patients with skin cancers, specifically non-melanoma skin cancers, such as Merkel cell, squamous cell, advanced basal cell, etc. So we are thrilled to have you here today, Dr. Park. It's great to get your perspective, another medical oncology provider caring for patients with skin cancer. So I'm curious to hear your thoughts. So we always hear about heart healthy and diet and exercise and really trying to, strengthen that heart muscle. But what about healthy skin? That's something that always bugs me because every human has skin and we need our skin to be as healthy as our hearts. So I'm hoping that you'll talk to me today about what we can do to keep our skin healthy as possible, because the skin that we're in will stay with us forever. So we want to do as much as we can to minimize that, specifically what we can do to minimize our risk of skin cancers. Some people will have higher risk for developing skin cancer and some people have a lower risk. So I'm hoping today we can just have a discussion about how you advise your patients on minimizing their risk. And for those patients that do have higher risk, which we'll also talk about, how you counsel them on minimizing their risk.
Yeah, thanks so much, Krista, for having me. I think this will be a great discussion. And as I tell all of my patients, the skin is the largest organ in the body. So It's really important that we pay a lot of attention to it and make sure that we try to, keep ourselves healthy.
Right. And that's such a great point because skin is our largest organ. And I think we all forget that sometimes. So certainly it's a big organ, it's our largest organ, and we forget about that often. So tell me, in your practice, you see patients with more advanced skin cancer, is that correct?
Yes.
And so they've already been diagnosed with a skin cancer. So what do you tell them? How do you describe to them what they can do moving forward in terms of protecting themselves for additional skin cancers?
Yeah, so I do see patients with more advanced skin cancers, but no matter if you're a patient that has been diagnosed with a skin cancer or someone that has not, UV radiation is the, best known modifiable risk factor for any type of skin cancer. And so I really tell my patients that, for primary prevention, we really need to focus on reducing our exposure to UV radiation. And that, can happen in a lot of different ways, in the use of sunscreens, shade, avoiding the sun at peak hours, things like that.
Yeah, and so you're in sunny San Diego, and I'm here in Boston, and so clearly we're on different parts of the states here. And you have sun all the time, and I have sun only maybe, if we're lucky, half the time. So for individuals that live in your neck of the woods, do you recommend different strategies for protecting themselves when the sun is out all the time, rather than like what we experience here on this side of the country?
Yeah, that's a great question. I think a lot of people think, oh, if you live, maybe on the East Coast or not in sunny San Diego, your chance of getting skin cancer or your exposure to the sun is less, but that's not true. The sun is there all the time and it actually penetrates the clouds 80% of the time. So it's really important that we emphasize to our patients, and this is something I specifically emphasize to all of my patients, no matter where you are, no matter how old you are, no matter what gender or ethnicity you are, it's really important to practice, good, safe sun practices to make sure you're protecting yourself from UV radiation. And so I would, give the same type of advice to a patient that lives in San Diego as I would to a patient that lives in Boston.
And talk a little bit about skin color, skin color, because there's myths out there that, darker skin can't experience sun damage. But can you talk a little bit about that?
Yeah, that's a great thing to clear up. Our skin gets pigment from something called melanin. And so darker complected people have more melanin. And, I think melanin, it does give an SPF of around 4 or so, but patients with dark complexions can burn just like, patients with fairer complexions. It is a myth that patients with darker complexions do not get skin cancer or do not have any risk from the sun. They need to take special precautions to protect themselves as well. And having darker skin also puts you at higher risk for other skin problems that are not cancer, but that are also really problematic, such as, getting hyperpigmented areas. Patients with darker skin may have other medical conditions that make them more sensitive to light in general. And so it's really important that they protect their skin for other reasons, not just for cancer reasons. And so we really need to think about being inclusive when we think about sun protection.
Yeah, you brought up some really great points too, because certainly it is a myth. There are a lot of myths out there. Do you recommend any different type of sunscreen for folks that are of darker skin?
Yeah, so I think the jury, it really depends on, what sunscreen is best for you is the one that you will wear daily.
Yeah.
But I think for darker complected patients, they can really, think about special companies that may cater to their skin. There's a lot of great ones out there if you just look them up online. Darker complected patients may also do better with a tinted mineral sunscreen. So mineral sunscreens are sunscreens that actually just sit on your skin and they reflect the sun's rays. And so some of them may have a whitish tint to them, but there are a lot of different companies that are now actually tinting the actual sunscreen so it matches more with your skin color. And there's different ways that they can make the particles that sit on your skin finer, so the whitish cast is not as visible as it would be if it was not so micronized. So there are different ways that we can protect your skin even if you have darker complexions.
That's a great point, which is actually one of the questions or one of the points to discuss, is talking a little bit about the difference between chemical and physical sunscreens. You just mentioned the word mineral sunscreen, which is considered a physical. You want to just talk a little bit about the difference between the two sunscreens and who you may recommend, chemical versus physical, et cetera, perhaps ages or somebody that's had a lot of skin cancer removal or may have a rash from treatment. You just talk a little bit about the difference.
Yeah, so as you mentioned, and Isa just said, mineral sunscreens are physical sunscreens. They, provide a physical barrier. They sit on your skin and they reflect the sun's rays. The other very common type of sunscreen is a chemical sunscreen, and they actually work by absorbing the UV rays. So you can think of a chemical sunscreen like a sponge that absorbs water, if you think of UV rays as water, and you can think of a physical sunscreen as a shield that can, block the water from entering your skin. The chemical sunscreens, they're really popular. There's, a ton of brands out there. I personally cannot wear them because my skin is sensitive. So I think if you're a person that has very sensitive skin, or, you tend to have allergies to different types of products, I think a mineral or physical based sunscreen is really good. When we think about ages, that gets into another point. Very young children, they just have a higher risk of getting, rashes or reactions to chemical-based sunscreens. And so for the pediatric population, it's probably better to consider a mineral or physical-based sunscreen. But other than that, I think either sunscreen, it works really well. It just depends on, I think the skin sensitivity, the tint, your skin color, what type of formulation you like. A lot of the products now come in, a stick, a gel, powder, or spray, and some may be more, you may like the feel of one over the other.
Yeah, I love what you said earlier, that the best sunscreen is the one that you wear, because that's so true. It's if you're not going to wear it, it doesn't matter what you get. And I always like to remind my patients and family and friends that the key to sunscreen is frequent applications. If you put it on in the morning, it's not going to last you until the afternoon. So frequent applications every 1.5 to 2 hours is certainly the key to successful sunscreen wearing. So let's switch gears a little bit. You mentioned the word primary prevention earlier. Just explain to our viewers what primary prevention means, and then compare that to secondary prevention.
Yeah, so primary prevention is preventing the occurrence of a skin cancer by reducing risk factors in an asymptomatic person, so a person without a history of skin cancer. So it's patients, I've never had a skin cancer, thankfully. So primary prevention for me is making sure that I stay in the shade and avoid UV exposure like that. I make sure I wear my sunscreen and reapply every 2 hours, like you mentioned, Krista, just to make sure that I'm keeping all my skin protected. Another way for me to decrease my risk factor to UV radiation from the sun. For secondary prevention, that is more so when a person already has had or currently has a skin cancer. So because they've already had one, you want to try to prevent ones in the future.
Yeah, and so that's important. So you and I see patients that already have an advanced cancer. And so it's sometimes a difficult concept to understand that we're kind of preaching prevention, but it has nothing to do with the cancer or the skin cancer that we're treating them for. This is to minimize risk going forward, because we know that people who have one skin cancer are at risk for developing another skin cancer, either of the same type or of different type of skin cancer, because we know that there is damage down below the layers of skin at the DNA level. So it's important to kind of separate out the reasons that we preach what we do. So your population of patients are advanced, like we just talked about. So they may have had a skin cancer that is beyond just being able to remove it from the skin. They may be undergoing whole body therapy, systemic therapy, like immune therapies or chemotherapies or radiation therapies. So when patients are undergoing those types of treatments, what is it that you recommend to them in terms of minimizing their UV protection? Are you worried about effects or interactions with the medications that you're using? For example, the immune therapies. Do you find that patients are more sensitive to sun exposure at the time they're receiving them?
Yeah, no, that's a great question. A lot of these immune therapies we use now, they can cause other types of, skin manifestations, such as, really itchy skin, really dry skin. They can cause really bad rashes. And so even if the immune therapy that I'm giving is not known to, directly interact with the sunlight, it's just really important that the patient really, protects their skin from the sun through various mechanisms, just because they're on a cancer treatment. And a lot of my other patients, especially my patients that are solid organ transplant patients, they're on certain medicines that do make their skin much more sensitive to the sun. And so even for those patients, even if I'm not treating any type of skin cancer actively, maybe I've treated their skin cancer in the past and they're doing well now, it's really important for them to also make sure that they're practicing, good UV practices, staying in the shade, avoiding peak sunlight hours, wearing sunscreen, doing all that they can to really minimize their exposure to UV radiation.
Yeah, that's a great point, because even medications that many people use on a daily basis can cause some sensitivity, like antibiotics. There are certainly medications that people have to take, but you can also completely avoid the sun. I think sun protective clothing is another great strategy for minimizing your risk, especially if there are sensitive skins or rash, or maybe they've had radiation and that area is sore. Clothing, particularly the SPF clothing that's embedded into the fabric, works very well. And those can be found anywhere nowadays that are relatively inexpensive, but stores like Walmart, Target, even some of the discount dollar stores, they have some of that clothing, which I think is a great tool. And then you can apply sunscreen to the areas of the body that are not covered by clothing. So that's a great point to bring up. Now, is there anything on the horizon, or what's out there in terms of like, what else can these patients do to protect themselves? Chemo prevention is a big word out there. Talk a little bit about what that means and what's on the horizon, or what may be of useful information for our audience.
Yeah, so chemo prevention is actually a type of secondary prevention. So it's to help prevent the development of a new skin cancer when you've already had one in the past. And chemo prevention is actually the use of some type of drug or agent. And these can range from things that are over the counter, like vitamins, but they can also include medications that have to be prescribed by a medical doctor. And so there's a lot of, interest in this, because some patients of mine, I see they keep getting skin cancer over skin cancer over skin cancer, and they do practice, very safe sun practices. So there's been a lot of research in this, and one I would like to highlight is vitamin B3, which is also known as nicotinamide. And you may have heard of it because it's gotten a lot of press in the last couple of years. But there was recently a study showing that if you took this vitamin twice a day for a year, if you're the type of patient that gets a lot of these non-melanoma skin cancers, it may help to in the future that you don't get as many of them. But it also still has some side effects, and some of those side effects may not be that the patients may not like it. Some patients get some diarrhea, some nausea. So it's not as benign as people would think, but I think if you're interested in learning more about it, it's certainly something to really bring up to your doctor, especially if you have a dermatologist or your primary care doctor. They also studied this drug in another high-risk patient population, solid organ transplant patients, but they didn't find that this vitamin B3 really did much for patients with solid organ transplant. And so I think for patients with solid organ transplants, they should be followed by a dermatologist very closely already, because they're at such high risk of getting multiple skin cancers that are typically more aggressive. And so for that patient population, sometimes the dermatologist has a lot of other tricks up their sleeves, such as drugs that are prescription medicines called retinoids that are sometimes used for patients that have acne, but they also work pretty well to decrease the chance of getting another skin cancer in patients with solid organ transplants, but they have a lot of side effects. So this is something you really need to discuss with your physician.
Yeah, I think that's good advice too, because as you mentioned, they all have side effects. And if you're undergoing treatment for an already diagnosed skin cancer, we want to make sure that it's safe to be taking these agents together. So it's always a good idea to talk with your team to make sure that they're aware that you're taking this or taking any type of supplement. Is there anything else that you counsel your patients about either to do or not to do for, let's say, the high risk population, those patients that may have had multiple, or they have an extensive family history, or there's a unique reason that they may be at greater risk for, say, a genetic syndrome or something like that? Can you talk a little bit about how you counsel those individuals?
Yeah, so if you are considered a high-risk patient, so either maybe you have a lot of moles, or you have a family history of skin cancer, you've already had a skin cancer yourself, or you're one of these patients that has a solid organ transplant. I think there are two things I really tell my patients if they fall in the high-risk category. One is really check your skin at home, and really use either your partner or someone else close to you that can look at the areas that may be hard to reach, like your back or the top of your head or the back of your head. And a lot of the skin cancers nowadays, they're diagnosed because the patient noticed something on them and then they tell their doctor. So it's really important to check your skin at home. And then the other thing I would recommend is really establishing at least care with a dermatologist, so that dermatologist can do a full body skin exam, especially if you're high risk, and then they can tell you how often they think that you should be followed, just to make sure that, if we do find a lesion, we take care of it quickly before it gets out of control.
Right. Dermatology definitely has to be, a main member of the team, along with your medical oncologist and perhaps your transplant provider or rheumatologist or whatever specialty provider is involved with your care for those patients that are immune suppressed. So do you have any other advice or any other thoughts about ways in which we can offer our patients suggestions about how to protect themselves if they've already been diagnosed with a skin cancer, because at least for me, at least in the Boston area, patients are really worried about their future and how, like you mentioned earlier, they may be doing all of the right things, but they're still getting either a tan or they're still getting diagnosed with a skin cancer. And it's like a slap in the face for all their efforts. And so any final words about how you can offer some suggestions to your patients?
I think, you just have to make sun protection a habit.
Mhm.
And so I think the best way to make something a regular habit is to connect it with something you already do every day, such as, brushing your teeth or, washing your face, and making sure you connect that to, sunscreen application, or to make sure that, you wear a wide brim hat when you go out if you know you're high risk. And then, hopefully that regular habit translates into the, yourself remembering that you need to reapply every so often when you're outside to really protect yourself. And so I think it's just really making, healthy skin habits just a part of your everyday life.
That's great advice. And your comment earlier about the importance of self skin exam. We have another webinar with Dr. Susan Boyko showing us how to do a full skin exam. So I would refer anybody interested to that video. It's a great video showing how to do a head to toe skin exam. So Dr. Park, I just want to say thank you for all of your insight and information. You shared some great strategies for patients to take home and share with friends and family members, and myself. I took away some well spoken advice. So appreciate your time. Thank you so much for being here with us today.
Yeah, thanks so much, Krista. It was great.